Well, there's been a huge amount of work being put into this already in terms of preparing the background case for a medical school for the County of Kent. There's still a huge amount of work to do though. We are submitting a bid and that really is the beginning of the journey. It's hugely competitive and we hope we'll be successful, and then there's a lot of work to do to bring it to life.
It is massively competitive. Why has the university decided to do it, to pursue this school?
So this is something that's been discussed for a long time, again across the county. Both universities felt that this time was right for us to collaborate on this particular bid. There is a call for funded places from the Higher Education Funding Council and Health Education England, and we felt that we had the right people, the right bid and the right support. And the time was right to put this one in.
And talking a little bit about that partnership with Canterbury Christchurch, why have you chosen to do that? Are they the right fit?
Well, we're two large universities in the County of Kent. Canterbury Christchurch has real strengths in educating the healthcare workforce. We have strengths in science. We collaborate already on a number of programmes and we want to collaborate on this. It brings together the strengths of both universities and it makes sure that we're bringing all that together to create something that we think is really innovative and will be great for the county. Both universities, as I said, already have facilities that they will be able to draw on. There will need to be some new facilities. It will be new students, new staff, and we'll need some new equipment, new laboratories and new ways of delivering education for medical students in particular means that we will need some new kit, as it were. So we've got things in place already. We've costed out what we think we need. We really, of course, as I said at the beginning of the journey, so there will be things that we will need to look at as we're developing it, and that we want the school to grow as well. So there'll be new things coming down the track later on over the next few years, but we need to get this started. It would make a massive difference for the county. It would absolutely, I think, transform health services here. We know that areas that do not have a medical school really are challenged in terms of their workforce, both recruiting a workforce and retaining a workforce. We know that if you put in an intervention like a medical school, that can transform that as well as transform the health outcomes for the people who live nearby and use those local health services. So we're really keen to get this going. We think we've got something that will make a difference, and I think that 22 million as part of that overall solution is really going to be the difference that means that we do something or we don't do something. So we're really keen to get this off the ground, and that's what we are all focused on right now.